If you take my obsession with spike ball, combine it with sprint training, add in a couple weeks of travel where my training was a little bit up and down, you get the end result of Achilles tendon pain. But I was able to take care of it pretty quickly. How, you might ask? That's what I'm going to teach you in this video. I'm going to teach you the steps that I use for myself to improve my Achilles tendon pain, and these are things that I recommend to my patients and clients who might be dealing with Achilles tendonitis, Achilles tendinopathy, or anything similarly. We're going to address Achilles tendon rehab 4 different ways. The first is load management. The second is improving movement dynamics to offload the tendon. The third is nutrition. And then the fourth is local reloading. The first thing you want to do if you have Achilles tendon pain is to stop the activity that's hurting. This is not one of those things that you can work through. Tendons become healthy when you load those tendons and then you rest. It's a little bit different than something like delayed onset muscle soreness, where sometimes you can use a concept called the repeat bout effect, where if you load the area in question, oftentimes it can improve soreness. That's not always the case when it comes to tendons. Tendons adapt a little bit more slowly than muscles, and that's because a lot of times the loading that we do to tendons is faster and requires higher force. We have to allow the tendons to recover in order to ensure that we don't progress to something worse, whether it's a significant bout of Achilles tendinopathy or tendonitis, or even a tear. So one of the best things you can do when you first suffer Achilles tendon pain is to take a few days and chill. But the worst thing you can do for Achilles tendon pain is nothing. And although overload is something that contributes to Achilles tendinopathy developing, we also want to be able to load to ensure the tendons are healthy. The first thing we want to do is make sure that our lower body loading is not only on the Achilles tendon. If you have limited ankle mobility or mobility elsewhere, what that can do is that can increase the load focally on the tendon. A healthy Achilles tendon is pretty stiff. When we see someone who's dealing with pain in this area, that stiffness is oftentimes lost. You see increased vascularity within the tendon, meaning it gets more imbibed with fluid. Normally, the tendon doesn't have many blood vessels to it. It gets most of its healing through diffusion of the synovial fluid, the fluid within the joints. Whereas in Achilles tendinopathy, the tendon gets imbibed more with fluid, and it loses its relative stiffness. It kind of works like a balloon. The tendon is like the surface of the balloon. It's floppy, it's lax. The internal structure of the balloon, where you would put air or water, would be like the muscle. And when that happens, the muscle is actually more concentric or shortened. That will limit your relative ankle mobility. Sometimes that can transmit more load to the tendon itself. Whereas ideally, if we expand the balloon maximally with water or air, the surface of the balloon actually becomes more tense. This would be an example of someone who has greater flexibility or mobility in the ankle, and therefore when that happens, the tendon itself will become more stiff because the surface of the balloon works similarly to the surface of the tendon. So we want to do things that ensure that we can create an eccentric position or orientation of the ankle joint to offload the tendon. That's going to involve improving ankle eversion and ankle dorsiflexion. These are associated with foot pronation. To loosen up the ankle and improve eversion, you're going to do this calcaneal roll. You're going to need some sort of elevated surface and a foam roller. Whatever side you want to work on, you're going to put that side towards the wall and on a raised surface or a book. Foam roller is going to go on the top part of the pelvis. You want to fall into it so that way I can be unweighted on the side that I'm working. I'm going to get heavy into that foam roller, not like leaning, but just thinking about putting my weight there and on the opposite leg. Let the knee bend. Here you're going to simply, small movement, breathe in, have weight on your outside heel, breathe out, have weight on your inside heel. You want to do this for about 20 reps on the affected side. The key with this is that it's small, so you don't want to see your knee wiggling back and forth. You don't want your foot lifting up. It's really just a subtle amount of weight on the outside heel and a subtle amount of weight on the inside heel. I can't illustrate this enough. The amount of motion that should happen with this is small. There's only about 5 degrees available of eversion. To put in perspective, 5 degrees, if we look at this goniometer, is only that much motion. To improve ankle dorsiflexion, I like a sandbag ramp squat. The ramp is nice because it limits the amount of ankle dorsiflexion. If you got Achilles tendon issues, you probably got a limitation there. And the sandbag helps shift your weight back so you can offload the Achilles. You're gonna keep the eyes on the horizon, keep the bag close to you, soft knees, make sure weight is on inside heel and base of the big toe. From here, you're gonna inhale, knees forward, butt down, make sure you keep those foot contacts. Exhale, come up. Inhale down, exhale up. Now before you do local treatment to the Achilles tendon, there's something simple that you can do before you do your exercises that can improve your outcomes with Achilles tendon pain. And that is supplementing with collagen. That need to be wearing a tank top when we're talking about supplements. You feel me? Now, normally, I'm not a big supplement guy. But according to this study right here, supplementing with 2.5 grams of collagen 30 minutes before you do specific Achilles tendon exercise can improve pain levels and potentially reduce microvascularity. And that's actually a pretty small amount. The normal serving for a supplement such as this is about 20 grams of collagen peptides. So if you just throw a little bit in your morning coffee or some water 30 minutes before you do your Achilles tendon exercises, it's not gonna hurt. Once you've downed your collagen supplements, we now wanna load the tendon. There's a sequencing that seems to work best for this type of pain. Conventionally, eccentric heel drops, or the Alfredson protocol, was used to improve Achilles tendon pain. But there have been some advancements in treatment since then. Isometrics, or holds in the short term to both help with pain and introduce loading into the tendon. Although the evidence on using isometrics is mixed. This 2020 study showed that it didn't really help with pain in the short term. But a flaw of that study was they used a hop test as the recheck. Well, there's a big difference between doing an iso hold and jumping. Ideally, we have to slowly expose the tendon to progressive load. Holding position and jumping is a big jump, no pun intended. Or was there? And in my case, using isometric holds, where you are standing on your heel and holding position, was a godsend for symptom relief with walking, and it also reduced local tenderness. The way that I did it was I held a halfway point on the heel raise for 6 sets of 45 seconds. And what's nice about these? Super convenient. You can literally do this anywhere. You can do it while you're working at your standing desk, talking to friends, or even when you're at the pool. I would perform these isometrics throughout the course of your rehab, but if you start to notice after a few days of this that you're not having any local tenderness to the touch in your Achilles, and moves like going up on your heel are more comfortable, you can then progress to heavy, slow resistance training. Or in bro speak, just do some heavy calf raises, bruh. What you're gonna do with this is you're going to stand, hold on to a dumbbell, and you're gonna do a 3-second raise up maximally, and then slowly lower for 3 seconds. I would start on the ground, and then as it gets more comfortable, you can progress it to a deficit. You'll want to work up to about 3 sets of 10 to 12 reps before adding weight, making sure that the tempo is slow. If it's been a few days and you're tolerating these calf raises without incident, it's time to reintroduce loading. This would be things like jumps or other plyometrics. The way that I typically introduce this is I will do single hops first, meaning you'll do a hop in the air, stick the landing for about a 3 count, hop in the air, stick the landing for about a 3 count. Typically, I'll program 3 to 5 sets of 5 with the hop and sticks. This one I would do every other day. If it's going well after about 3 times, then you can progress to multi-hops where you hop continuously, spending as little time on the ground as possible. That would be the basic progression that you would need to tolerate loading through the Achilles tendon. But depending on what sport you're getting back to, you may try a few different things. For example, I play spike ball. I need to have a lot of multi-directional movement with that. So my progression beyond that was doing some change of direction stuff, such as a 5-10-5. And then from there, I would do spike ball drills where I'd have to hit the ball and then move in a specific direction and then try to do a different direction. You want to expose the tendons to various ways of loading. And the last thing that you want to do is when you return to your sport or activity, don't go full bore. What I mean by that is if the volume of activity that you were doing led to Achilles tendon pain, you want to do less than that, especially considering if your Achilles has been bugging you, you're likely not training at the level that you were previously. So you'll want to go about 50 to 75% of the amount that you were moving at before. In my case, I took a few games off playing spike ball. And when I was able to do that, I was able to play pretty much the entire time without Achilles tendon issues. I did experience a little bit at the end, but by the next day, I was good. So to recap, if you want to improve Achilles tendon pain, you have to reduce loading initially, improve the movement dynamics locally, supplement with collagen to improve collagen synthesis in the tendon, and then reintroduce loading, and then manage the amount of activity that you do when you return to your sport. Now, it may be that your Achilles is feeling better, but you might notice that your calves are still super tight. Perhaps you can't squat as low as you like. That could be a risk factor for increased loading into the Achilles. If that's you, then I would check out this video right here where I dive into how to fix tight calves.